Hi, how are you? My name's Karissa. I'm going to be your nurse today. We're going to be changing the dressing on your wound. Are you feeling any pain at all? No? Okay. I'm going to go gather our materials and come back. So now we're going to perform hand hygiene. I'm going to put on gloves. I'm going to lower the side railing. I'm also going to identify my patient using two identifiers. Just going to lift this up, and I'm going to lower the head of the bed. And I'm going to raise the bed up to a good working level for me. Okay, and I'm going to lay my chuck pad down. And he was feeling no pain. I'm going to remove the dressing, and when I remove it, I'm going to be assessing for the color, the amount, the type, and the smell. I'm also noting that there was 2 4x4s that were packed inside of the wound, and I'm going to make sure that the document matches that as well. I'm going to palpate for any bogginess or rebound tenderness, and I'm going to be looking at the patient's face as well to make sure that he is not feeling any pain, making sure I'm around the outside of the wound. Okay? And now I'm going to measure the length and the width in centimeters. So it's about 13 centimeters. Two centimeters, and then I'm also going to be measuring the depth of it using the sterile cotton tip. Placing it in the deepest part of the wound. I'm also looking for any granulated tissue, which indicates that it's healing. Making sure that my fingers do not touch the wound, and measure the length of this as well. Which is about 2 centimeters as well. And then now I'm going to remove my gloves, and I'm going to start my sterile field, performing hand hygiene first. So I'm going to set up my sterile field, opening this away from me. And I'm going to put on my sterile gloves. I'm going to actually, before I do that, I'm going to get rid of this because I'm not going to be using this. And I'm going to make sure I'm pointing it away from me. And then I'm going to dump my contents onto my sterile field. And then now I'm going to put on sterile gloves after I pour the saline, which is I'm going to make sure hasn't been used within the, if it's been used within the past 24 hours, and if it was opened, I would make sure to lip it. And now I'm going to pour the sterile saline 4 to 6 inches above, making sure that there's no splashing. Again, making sure that the label is against the palm of my hand. And then now I'm going to use sterile gloves. And now that I have my sterile gloves on, I can now finish setting up my sterile field. You don't need the pin, so I'm going to discard this. I'm going to fluff the 4x4s. I'm going to separate them all first so that it's easier for me once I have to come back and place them over the wound. So I'm going to be using 2 of them because that's how many were inside of the wound and that's how many were needed to be documented. Sorry, these are a little tricky. I'm going to place them inside of my sterile field. I don't know, I have such a hard time with these. Okay, hang on, we're getting there. All right. Okay. And then now I'm going to clean the wound as well. And starting from in the middle, from the dirtiest, going in a downward motion, twirling. And the side, starting again top to bottom, twirling in a downward motion. And again, top to bottom, on the side, twirling in a downward motion. And then now, with my non-dominant hand, I'm going to use this hand, and now this hand is now in a clean technique. And grabbing my sterile forceps as well. And then now packing the wound. Making sure that the tissue does not touch the outside of the wound. Just one. And grabbing the other one as well. Again, making sure that the gauze does not touch the outside. Okay, and now I can discard my forceps and place the gauze pads over the wound. Fixing that as well, and then now I can remove my sterile gloves and go back into clean technique. Performing here. And then I'm now going to tape the wound. I'm going to leave one piece of tape so that I can write my name, the date, and the time. I'm going to tape using a window border. And then writing my name and date on this one. And the time. And then placing this on the patient. And now I'm going to discard all of this. And I'm going to cover my patient. Lowering the bed. Raising the head of the bed as well. And the side railing. And placing the call bell near him so it's within reach.